All right, today we're diving into a really foundational tool in emergency medicine, the Parkland Formula. It's a surprisingly simple calculation that helps manage one of the most intense medical emergencies you can imagine. And honestly, understanding it is going to change how you think about burn injuries forever. So, let me ask you a question. When you picture a really severe burn, what do you think is the number one most immediate danger? Your mind probably jumps straight to the fire itself, right? Or maybe infection down the road. But the thing that can kill you the fastest, it's actually completely invisible. The real answer is it's a lot sneakier. It's a massive, invisible leak of fluid happening inside the body. You see, a bad burn torches the blood vessels, and they start leaking plasma out into all the surrounding tissue. This causes a huge drop in your blood volume, a condition we call hypovolemic shock. And that right there can lead to organ failure and death fast. So you've got this invisible leak wreaking havoc. How in the world do you fight that? Well, you fight it with a precise, calculated response. And that's exactly where the Parkland Formula comes in. It's basically a lifeline designed to stop that devastating fluid loss in its tracks. So what is it exactly? At its heart, the Parkland Formula is just a simple equation that tells doctors and paramedics precisely how much IV fluid a patient needs in those critical first 24 hours. The whole point is to get ahead of that internal leak and stop that deadly hypovolemic shock before it takes hold. So what does this life-saving math actually look like? Now, it might sound complicated, but I promise it's built on just a couple of key pieces of information. Let's break it down. Okay, first up, we have this thing called TBSA. That stands for total body surface area. It's just the percentage of the person's body that's covered in serious burns. We're talking second or third degree burns here. Little first-degree ones, like a sunburn, they don't count for this. Medics often use a quick guide called the Rule of Nines to get a fast estimate out in the field. And here it is, the whole thing in all its elegant simplicity. It's just 4 milliliters of fluid multiplied by the patient's body weight in kilograms times that TBSA percentage we just talked about. That's it. 3 simple numbers give you the total amount of fluid that patient needs over a full day. Okay, let's put this into practice so you can see how it works. Let's say we have a patient who weighs 70 kilos, that's about 154 pounds, and they have burns covering 30% of their body. You just plug it in, 4 times 70 times 30. That gives you 8,400 milliliters. That's 8.4 liters of fluid. That is a huge amount, and it just shows you how serious that internal fluid loss really is. Now, knowing how much fluid to give is really only one part of the puzzle. The other absolutely critical piece is when you give it. This is a true race against time. Here's how it works. The formula breaks that 24-hour window into 2 very different chunks. You give the first half of that total fluid, so in our example, that's 4,200 milliliters, over the first 8 hours. Then, the other half gets delivered more slowly over the next 16 hours. That really aggressive push at the beginning is what's so crucial for stabilizing the patient. And this is a pro tip that can literally make or break the outcome. The clock doesn't start when the patient hits the hospital doors. It starts the second they were injured. So think about it. If someone was burned 2 hours before they even got to the ER, the medical team doesn't have 8 hours to give that first half of the fluid. They only have 6 hours left. It makes what those first responders do on the scene absolutely vital. All right, like any powerful tool, you've got to know the rules to use it correctly and safely. And these aren't just, suggestions. These are critical guidelines to prevent making a bad situation even worse. The rules are pretty straightforward, but they are so important. We've hit the big ones already. Only count the significant burns and start that clock from the moment of injury. But that third one is just as critical. Don't over-resuscitate. Giving too much fluid can be just as deadly as giving too little. It can cause massive swelling that shuts down an airway or cuts off circulation to their arms and legs. This formula is a safeguard against that kind of dangerous guesswork. So, let's zoom out for a second. Why is this little formula such a game changer? Well, it's a triple threat. First, it's our best weapon against that deadly shock. Second, it gives medical teams an immediate action plan, sometimes way before other vital signs have even had a chance to stabilize. And third, it creates a common language, a standard of care that flows seamlessly from the ambulance crew to the specialized burn unit. Look, if you remember nothing else from all this, burn this into your brain. 4 milliliters times weight in kilograms times percent TBSA. You give half of that total in the first 8 hours and the other half over the next 16. That's the heart and soul of it right there. But I've got to add one really, really important caveat here. The Parkland Formula is an expert guide. It's not a rigid, unbreakable law. It's the starting line. Doctors and nurses have to be constantly monitoring how the patient is actually responding, looking at things like urine output, and tweaking the fluid rates as they go. At the end of the day, the patient's body, not the math, gets the final say. So we've spent all this time talking about how the Parkland Formula is a lifeline that saves people from getting too little fluid. But that just opens up another critical question, doesn't it? What happens when we give too much? The dangers on that side of the equation just go to show what an incredible balancing act modern burn care truly is. And that's our look at the Parkland Formula,